few more about the other organisms. So, Klebsiella, Enterobacteriaceae, and Hafnia. So, now I think you have sound knowledge on E. coli. Read the text as well as few textbooks, then you can get the what you should know. So, recalling something, right habitat. What is the type of organism? What are the test positive? Test positive, don't recall. Try to identify what is the more, how we can differentiate that particular organism using that. Then, what are the diseases it causes? What is the mode of transmission of pathogenesis? Then, how we detect the signs and symptoms? How we detect the disease? What are the treatment modalities available? Likewise, it's applicable to other organisms. When we do the case-based discussions and clinical lectures, we can integrate that particular into a subject area. Then once you have seen the patients, you can apply that. So application part, it's, I'm not saying up to you, but when you see the patient, try to recall and try to apply. Now you are doing the clinicals in third year when you are back. So it's time to see some infectious disease patients and try to recall what you learned, how we apply this. Likewise, that's the method of learning. You can ask any question or anything when you are back, even in the Viber format, even from the LMS, that's up to you. So about the Klebsiella, Enterobacteriaceae, and Hafnia. They also, as said earlier, they are in Enterobacteriaceae group. Common characteristics are there. They're found in the small intestine. Most are here. Klebsiella is a pathogen. Enterobacteriaceae and Hafnia are a little bit of opportunistic pathogens. Klebsiella species. So found in GI tract usually. There are 4 major species, but Klebsiella pneumonia is most commonly isolated species. There are few. Oxytoca likewise. They have a polysaccharide capsule, which protect against phagocytosis and absorption of antibiotics. And when you see the colonies, they are much more mucoid colonies and having a yeast odor. They cause usually nosocomial pneumonia, but they can cause any infection. It's a non-motile, gram-negative, oxidase negative. There are 7, but Klebsiella pneumonia, Klebsiella oxytoca, and rhinoscleromatis, that will be enough. Most medically important, as I said earlier, it's a pneumonia. Then oxytoca also there. Nowadays, it's emerged as nosocomial hospital-acquired pathogen. So you can go to this and appreciate this. So that's what I said. It's lactose positive. Also, they're urease positive compared to E. coli. It's a non-motile compared to E. coli. You can say mucoid colonies. Compared to E. coli, it's a mucoid. Virulence factors considering capsule adhesions, ion capturing ability. Clinical significance causes pneumonia, mainly in the immunocompromised ones, and leads to permanent lung damage in a frequent occurrence. A major cause of nosocomial infections such as septicemia and meningitis. About the Enterobacter, there are a lot of organisms. Enterobacteriaceae and aerogens, so most common. Urine, blood, and CSF.